This is the Man Up Podcast, a doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask, we have the answers. This week, our episode is titled, No More Monkeying Around. Let's talk about monkeypox. I'm Dr. Kevin Chun. I'm joined as always with my co-host, Dr. Justin Dubin. Great topic today, huh, Justin?
It was an excellent talk we just got off with Dr. Karl Saardi, who is a good friend of the podcast, went to college with me. He's a dual internal medicine and dermatologist certified physician. He's at GW and he's at the front lines of this thing. He's really treating a lot of patients with monkeypox as he goes ahead and tells us what his experience was. It was pretty interesting to hear that experience, right? Right, Kev?
Very, very interesting. And look, I'm sure like me and you and our listeners, we just got past this whole COVID thing, not got past, sorry. It seems like
we're
COVID,
trying to, yeah.
We're trying to. But, it just seems like, another infectious disease, coming about, starting to get worried. And we're starting to see it more and more and more in news. And so, I'll speak for myself. I really didn't really know much about monkeypox. I just know just a few sparse information. I see on Twitter, I see on the news, and so I think it was a really great episode because he gave really good information, kind of top to bottom of what to kind of know about monkeypox. Right, Justin? Yeah,
for sure. And I think that you hit the nail on the head. And I think it's important timing because we mentioned a little bit on the episode that there is this bad stigma that's starting to develop about it. There's stuff that you're seeing on social media that isn't accurate, that's offensive. And we're trying to really create the right narrative with accurate information and determine, who needs to know what, how we need to react, how we can protect ourselves, and how to identify if you're at risk for monkeypox. And, we also talk about how, although, we are seeing it, hopefully this won't be a thing, but we felt it was a good time to kind of really get the information so that we can all protect ourselves.
100%, Justin, 100%. As doctors or as researchers as well, we're still learning a lot about it, right? So it's important. It's important to know that, look, everything that is the information that we know now, but we are still learning a lot more about it. And this is like what the best knowledge that Dr. Saardi, who is a true specialist, he's one who really is in the thick of it right now, understands about it. So,
and it's important to notice that he does say that. He says multiple times, he's like, we're still learning more.
Absolutely.
This disease has been around for a long time, it seems, but we really haven't seen it at this level. So yeah, you're right. We are learning more about it.
Yeah.
So, what we're hearing today may not 1,000% be correct, 6 months from now, but we are giving the data that we have at this moment. I think that's a really good point.
Yeah, absolutely. So, shall we jump straight into it?
I think let's get into it. Enjoy, guys. I think this is a really interesting episode and really helpful for a topic that is as timely as ever. So enjoy.
All right. So we are still trying to get over COVID here. And now we have this new disease, monkeypox, and it's spreading. In July, the World Health Organization actually declared it as a global health emergency. At the time of this recording, August 17th, 2022, the CDC says there are over 13,500 cases of monkeypox in the United States. So, Dr. Saardi, I know you've been kind of at the front lines of this in Washington, D.C., managing a lot of patients with monkeypox. Why don't you tell our listeners what your experience has been like so far with it?
Yeah, so I think, I'll just tell you guys a little bit about myself. I'm a dermatologist, but I also happen to cover our affiliate hospital, the George Washington University Hospital, and any patients who are admitted there with skin disease or develop skin diseases while they're in the hospital. And I think it's a little bit of deja vu for everybody. When COVID got started, you think that we kind of would have invested a little bit more in public health and preventing things like this from kind of happening again.
That's a good point.
And I think a lot of us who are dealing with monkeypox now are a little bit frustrated at the way things are going because you'd think we'd be able to see this coming. Um, but yeah, it's definitely here. Um, we probably, um, I've probably I've taken care of like dozens of patients now with monkeypox at this point, and the first couple of times it was kind of jarring, but we're learning more and more every day. And it seems like we are at least a little bit better prepared because this is something that is related to disease that we've known about for centuries, like smallpox. Um, and I guess from the patient standpoint, the one thing that I've kind of been surprised about is how much pain the condition causes. Um, Obviously there are a lot of symptoms associated with COVID, but the pain really seems to be the predominant one from monkeypox, and that is definitely one of the things that patients will tell me about after they've recovered how horrible it was.
That's very scary to hear, especially
Yeah.
when we're talking about
trouble
things.
connecting to the internet.
Sorry, that was Alexa.
Take a look at the help
Shut up!
section in
Stop,
your Alexa
please.
app.
So anyway, yeah, that's very scary to hear, and it's unfortunate because you're right. We've gone through this process for the last 2+ years at this point, and it seems like it's the same old thing. It's deja vu all over again, as you said. So let's just kind of start very basic for our listeners. Like, what is monkeypox?
Yeah, so monkeypox is a virus that is pretty similar to smallpox. And usually it will cause kind of like symptoms like fever and fatigue initially. And then afterwards, people will develop these kind of characteristic pox or skin lesions. They look like little bumps, sometimes a little bit fluid filled. And as I mentioned, pretty painful. Probably the closest thing that, people would be able to relate it to would be um, either something like chickenpox or molluscum contagiosum, which is another condition, another viral condition of the skin that causes little bumps, runs its course over a few weeks or months, and then kind of goes away.
So you mentioned, when you were first talking about it, you talked about like how it's very painful, and so I'm assuming it's linked to these bumps that are kind of, that are kind of forming. Are there any specific places like on the body that it forms, or it can spread like anywhere?
Yeah, it can be all over. It can be, head to toe, but the majority of people that we're seeing that have monkeypox have lesions in the kind of anogenital region, like on the genitals and around the anus.
So now we kind of mentioned what happens, and the pain is obviously a big thing. The blisters. Is there some potential, like permanent effects of monkeypox? And how long are these pox lasting? And then is there another stage? What happens?
Yeah, the condition tends to run its course anywhere between a week and 4 weeks. And some of the more permanent complications would be scarring. If anyone had, probably a lot of us are people our age, Justin and Kevin, we probably all had chicken pox, and I have actually one
Right.
chicken pox scar on my temple right here. That's probably one of the more common things that could happen. Um, it can actually cause a inflammation of the brain, or what's called encephalitis and meningitis, um, in people who have problems with the immune system. Um, and I think there have been a very, very small number of deaths due to monkeypox
Really?
reported.
Okay. So it's not like you're going to walk out okay every time here if you get monkeypox. There's potential long-term effects. The short-term, it sounds incredibly painful and not fun at all.
Yeah.
So definitely not a fun thing to get monkeypox. So, I mean, just to follow up with that, how do you get it? How do you actually get monkeypox?
Yeah, so I think probably upwards of 95% of cases have been sexually transmitted. Um, there have been, reports of people getting it from close skin-to-skin contact from someone that was infected or recently infected. And I think it's probably less than 1% of cases have been transmitted through like contact with shared surfaces, like common surfaces. But that seems to be very, very unusual. Right now in the hospital, we're kind of taking all of the COVID precautions with, the N95 masks, the face shields, the gowns, gloves. But I for sure have exposed myself accidentally, not knowing that, what ended up being monkeypox. And I haven't gotten it yet. So it seems like
I hate the fact that you said yet. I hate the fact that's like what we were talking about with COVID. It's like I haven't gotten it yet. That's very scary. But just to clarify the sexual transmission, is it sperm or semen? Is it vaginal fluids? Is it blood? Is it sexual fluids? Or is it like actually sexually something touching the pox? Just to clarify, because, is it like, an HIV or a hepatitis where you're having engagement and it doesn't matter if you're touching the pox, or is it like chicken pox where I touch the chick, like I'm engaging in sex, but I'm still having that contact?
Yeah, so the skin lesions definitely are infectious, especially the fluid and blood that can come out of them. But it does seem to be, semen does seem to be a very highly infectious fluid as well. Yeah, we're not sure, but it can be detected. The virus can be detected in semen up to 12 weeks after infection. We're not sure if it's still infectious at that stage, but we do know that people have contracted monkeypox and people who have recently recovered. So who've had sexual encounters with people who have recently recovered. Actually, the very first case I saw was someone who had a new sexual encounter, and after the encounter, their partner told them that they had recently had monkeypox, but they were clear, and that's actually how they got it. We're not sure how long people will stay infectious for, but we tell people to use protection for 2 to 3 months at least after having monkeypox.
I think that's really important information because
yeah, for sure.
What you just said there, like I didn't know. Just the idea of like that, with some of the other like more evident diseases that you can actually see, you're like, if you don't see the lesions or anything like that, you can be like,
herpes,
it might not be in the
like
quote unquote
right.
active phase, whatever. But in this case, for our listeners, the recommendation is 2 to 3 months. Am I correct, Dr. Saardi? That's what you said?
Yeah, that seems for most people, that seems to be the right move.
And it's very different, right? The implications are very different here than COVID, where we were isolating. Is it okay if you recovered from monkeypox? And then when we're talking, if it's something that's spread through semen or blood, if you are a person who has recovered from monkeypox and you no longer have the lesions, are you saying you need to isolate yourself completely for 2 to 3 months? Or is it, sexual interactions, physical touch? Like, can you go outside and engage with people, or are you really isolating yourself?
So it seems like, after the lesions have kind of crusted over, the skin lesions themselves aren't that infectious anymore. So we think it, may be more like other bodily fluids that are infectious after that phase. So I think for most people, we've been telling them that it's okay to go back to work and school and things after, the lesions have crusted over, provided that, they can keep them covered. And that's kind of what we've been doing moving forward. But it's hard to say. And I think as we kind of learn more about this, we'll be able to advise people a little bit more accurately.
And so, you're out on the front line. You're treating a lot of these patients coming in with monkeypox. So could you tell the listeners, like, how do you treat monkeypox? Is there a cure? What are we looking at?
Yeah, so we actually, kind of one of the parts of monkeypox where we got off on the right foot is that there's actually a really great and effective, super safe medication called tecovirimat. The brand name is TPOXX. It's FDA approved for smallpox, but it really works extremely well for monkeypox as well. Most people feel better within 2 to 3 days of starting the medication. So we're lucky in that we had that where we basically didn't have any treatments for COVID at the start of it.
Is this
and we're kind of just trying everything out there.
Is it just like an oral med that you're taking?
Yeah, that's what it is.
Yeah, it comes in an oral and an IV form. I don't know if you guys caught the John Oliver segment this past week on monkeypox, where they were talking about how hard it is, to get the medication from the CDC.
I saw that.
Yeah, it requires like a lot of forms and things like that. But luckily in the hospital, we kind of have a small supply and we're able to treat people relatively quickly. A lot of people actually do come into the hospital because the pain is so bad and they need, actually pain medications through the IV, um, through like an IV catheter in order to be able to manage the pain.
Yeah. So even with the medications, when you're giving this medication, when you're treating the patient, they still have the side effects potentially, like, the pain, but it does cure the disease and it makes the course shorter. Is that basically what it's doing?
Yeah, we've seen a lot of people. We actually just had a small case series that's going to be published soon about uh, the a lot of patients will come in with proctitis, which is inflammation of the rectum due to the monkeypox virus, and once they get started on the medication, within 2 to 3 days they start feeling a lot better. Um,
Right.
you can imagine having painful skin lesions in that area. It makes
Yeah.
it hard to have bowel movements and hard to sit down. Um,
Oh yeah.
and yeah, the tecovirimat has really been very effective for that, and it's great seeing patients improve. Once you get them on the right treatment.
All right, that's good to know. So the good news is we have a treatment, and I mean we'll talk a little bit later about the vaccine as well, but I want to get into a couple other things first. So we know, and it's a natural segue to what you're talking about. The proctitis is, we know for the most part, the people in the United States who have gotten monkeypox are men who have sex with men. Why is this population more susceptible? Why are they getting it at this time?
Um, we don't really know. There's a couple of theories in terms of it may just be spreading amongst their particular sexual networks, and there's really nothing preventing it. There is actually nothing preventing it from um, crossing over into the heterosexual population, and we are seeing probably about 4 to 5% of cases now occurring in women and heterosexual couples. Um, it could be, just a more of a social thing, an epidemiologic thing, or it could be something such as, that semen is a more uh, is a better vector for the virus than,
Interesting
than
point.
vaginal
Yeah, I
fluids,
didn't think about that.
where it's easier for like a male to transmit it to a female, but not the other way around. So it may not be spreading as much in heteros. We just don't know, to be honest. If you can get it through, skin to skin contact or contact with, skin lesions, there's really no reason why it should only be spreading amongst the men who have sex with men population. And it's kind of unfortunate, because it's led to a lot of stigma about just the monkeypox illness. In and of itself. Like I'm sure you guys saw that like TikTok video of someone who had a like a small little bump on their leg, and they
Oh yeah, I saw
like
that.
someone on the
Yeah.
train like took a video and was like, oh, is this
Yeah.
monkeypox?
Oh yeah, it's
It's
terrible.
And she
gone.
actually ended up having like another.
There's
skin
really
condition
bad
called
tweets about
yeah.
it. Kevin and I were just talking
Yeah.
about it. There was some doctor that tweeted something that wasn't great.
Yeah, the person on the
there's
TikTok actually had like another medical condition, and
Oh yeah, she clapped right back. It was great.
yeah, right. But it's terrible, and I think you made a really good point though. Like all the news has been kind of sent around like, oh, this, they try to highlight it's found in men who have sex with men, But the important point that you made here is like, look, it can also happen also in heterosexual couples too. It just happens to be currently right now it's within this, as you say, kind of like maybe sexual network. It could be maybe that it remains a little bit more in semen. Still things we don't know, but it shouldn't be stigmatized, to this certain population. What is your recommendation though to guys in general? What is the best way to protect yourself from monkeypox?
I think knowing your sexual partners and just practicing the normal safe sex routines. Probably something more like barrier protection, like latex condoms, would be the way to go. I don't know that there's anything that's like 100% effective at preventing monkeypox. I'm not even 100% sure that latex condoms would prevent transmission if someone very recently had it. If you are someone who has multiple sexual partners, it probably is not a bad idea to get the vaccine if you can. They're kind of prioritizing men who have sex with men just because of the high number of cases in that community. But I think probably just doing all the normal safe sex stuff, and then getting vaccinated, when you can, if you think it is
So to kind of
seemingly making
summarize
a
there,
cause.
the guys who are at risk right now are men who have sex with men, who maybe, or others who maybe have multiple partners. Um, and the key here is identifying yourself as high risk, identifying and maybe communicating with the people that you are engaging with. And then if you consider yourself to be high risk based off of what we talked about, to get the vaccine. Now, we know through the news and through the medical community, the vaccine has been rather limited in our ability to distribute it. Is that correct? And then can you just tell us a little bit more about the vaccine and how successful it is against, preventing getting monkeypox?
Yeah, so there's two vaccines that are out there. One of them is the old smallpox vaccine. I
Right.
think it's called ACAM 2000 or ACAM 3000. Um, that one has like a lot of potential side effects, and not everybody can get it. Like if you have another skin condition like atopic dermatitis, you can't, or eczema, which is a super common skin condition,
Yeah.
you can't really get that one. But Jynneos, which is a smallpox, monkeypox vaccine, is very effective, over 95% effective at preventing, disease. Basically no, uh, risk of causing any kind of adverse react. Very low risk of causing any kind of adverse react. Nothing zero risk,
Right, of
Um,
course.
but it doesn't have like the same contraindications that the regular smallpox vaccine has. It's a 2-dose vaccine series, 1 month apart. Actually, I have to say, in DC, it's been pretty easy to get. A lot of my patients, have been able to get it relatively quickly. And then also, getting vaccinated if you know you've potentially had an encounter as soon as you find out about it, can actually prevent the disease as
Oh,
well.
wow, that's good to know.
Wow, that's really good to
Yeah,
know. Really good to know.
yeah, they're
Yeah.
using it for like what's called post-exposure prophylaxis.
So
So
who are
even
you
that
like?
one dose, sorry, go ahead,
Yeah,
Kevin.
getting that first dose quickly can be really
That first
important.
dose quickly, even though it's a 2-dose thing, is going to
Mhm.
do it's going to do the trick, at least help protect you. What were you saying, Kev? Sorry.
Yeah, no. So you said the vaccine is pretty readily available in DC. Who are you recommending to go out and get this vaccine?
That's a great point. Great question.
Actually, a lot of patients are coming in and asking me if they should get it, and I, tell them yes. If you have, multiple sexual partners, if you're a man who engages in, sexual intercourse with other men, and you feel like it's in your, social network, or you've heard of people who have had it recently, it's probably not a bad idea to go ahead and get it. Um, and but yeah, there definitely have been shortages. Um, Again, kind of going back to that John Oliver piece, in New York City, it's been quite difficult to get. The doses have been pretty limited. And he also talks about how we let like several million doses expire a little bit, very, very early on in the outbreak. I think earlier this year. But we let millions and millions of doses of the Jynneos vaccine expire.
Oof, that's not
Um,
good.
yeah.
Terrible timing. Terrible timing.
Yeah.
All right, so we know who should be getting the vaccine. Now, I mean, we learned a lot so far, I think, because
Yeah,
I felt like for the most part, people have not been, you see it on the news, you don't really know exactly what's going on. And
right.
we have this current issue. It seems like it's gaining more and more patients, or more and more people are getting it, and you can attest to that. And the data, I think, can attest to that. So the really question is, do you think this is going to continue to really spread amongst the U.S., or do you think we're going to get a grasp upon it? Especially with one of the concerns coming up is, we're going back to school. It's the end of
Mm,
August. We're going back to
good
school.
point.
Kids are going
Good
back
point.
to high school. They're
Yeah,
going back to college. All I think about is, these are insane vectors for any kind of disease. It doesn't have to be monkeypox. It could be anything to
right.
spread. Now, is there a reason for concern that there's going to be, a problem with monkeypox in schools and colleges, and getting a good grasp of it in the United States as we go on?
I really hope not.
Me too. I mean, I think
It's
we
been
all
a,
agree. Let's
Yeah,
hope this doesn't become what we have seen in the last 2 years.
yeah. There's this concept, kind of this concept of like One Health, where uh, all these like diseases that are kind of spread globally, can be related to things like poverty and climate change, and but theoretically, something like monkeypox should be eradicable with large vaccination campaigns. Um, I think we're probably going to see low level transmission for quite a while until we can really get a good number of people vaccinated. Um, I don't know if the back to school thing is really going to make too big of a difference. I know we really started seeing a big uptick in cases here in DC towards the end of Pride Month, which may have just been due to kind of an influx of people into the area. Um, and it may have just been a coincidence because that's kind of when the outbreak was starting. But hopefully, we'll be able to. We're still on, much better footing than we were with COVID, where we have effective treatments, good vaccines. It's also like a more, I think, visible disease than a COVID, where there's a lot of like asymptomatic spread with COVID,
Right.
which
That's
seems
a
to
good
be
point.
less of an issue with monkeypox. Um, and
Monkeypox doesn't spread as easily as COVID. I mean, we're talking about air droplets and breathing versus
yeah,
physical
I'm assuming the
contact,
R is a little bit,
insects.
not as high as it was with COVID, right? So,
Yeah. So,
yeah.
so I agree with you 100% there. So,
Actually,
it's
probably one of the most encouraging things. So the CDC updates the case counts every Wednesday, and I actually just looked it up before we started talking, and it seems like it's leveled off, maybe headed down a little bit.
great.
that's great news.
I think they were up as high as 4,900 cases um, this past Monday, or maybe it was the Monday before, and it's kind of been a little bit lower the last 2 Mondays or this past Monday. Because all the tests that get done over the weekend at like urgent cares and ERs don't get reported until Monday, so there's always a huge spike on Monday. But hopefully, we'll really get a handle on it.
Well,
All right.
I think this was great info, Dr. Saudi. I learned a lot. I'm sure Justin did too. Just as a final, like a summary, if guys were only to listen to like one portion of this podcast and they were supposed to just take one thing out of this episode, what is the main thing that just we need to know about monkeypox?
Yeah, I would say practice safe sex and assess your own personal risk, and if you feel like that risk is high enough, go out and either get on the waiting list and get vaccinated.
Talk to a doctor, man. That's what you're saying, right? You're saying talk to your doctor. And who are you talking to, though? Seriously, like, is it a dermatologist
Great
you're
question.
going to see? Is it an internal medicine? Because obviously you're both. You're a unique person where you are both. Who, if someone wants to talk to a doctor for these things, who are they going to see?
I would say your primary care doctor is a good
Okay.
place to start. But if you happen to be, like at a travel medicine clinic, meeting with an infectious disease doctor or a dermatology clinic, or, your skin check or anything else, hopefully anyone you'll come across in those settings will be able to direct you to the right resources. I think a lot of the vaccines are being given out by like state and local health departments. Like for example, we don't have them in our clinic, and I don't think even the primary care clinic has them. And I think all the vaccinations kind of right now are going through local health departments.
All right. That was great. I think that was a great way to end. Very informative, Dr. Saardi at GW. So, if you're in the area, make sure to look him up over there. He's fantastic. As for Kevin and I, thanks for listening. As always, questions, comments, concerns, please feel free to reach out to us on our social media platforms. Justin Dubin, MD, Kevin Chu, MD. We also are on the Man Up Pod on Twitter, Instagram, as well as TikTok. You can listen to all of our podcasting, our podcast episodes, either on our website, which is what, Kevin?
It's at www.themanuppod.com.
And you can listen there. You can also listen to on iTunes, Spotify, any other podcasting platform. We always appreciate you subscribing, downloading, giving us a review and some comments. Always 5-star review. For Kevin and Dr. Saardi, thanks for listening. Until next time, have a good one, guys.
See you guys.